you to the Chamber and to the sponsors for continuing to make this kind of programming come together. We really appreciate the opportunity for Catholic Charities to share a little bit of insight about what's going on, but also I just want to sort of say right up front that what we're sharing is just a microcosm of what thousands of similar service organizations in this community are going through right now, the kinds of changes that they're making, and hopefully the kinds of really incredible stories of how this community is stepping up. I first of all want to thank all of you for showing up. We're thrilled that you all dialed in, tuned in this morning. This is a really strange time for everyone, and everyone's situation is really different, but everyone's situation is difficult in its own way. So that you all are taking the time this morning to be with us, to learn about what's going on with some of our most vulnerable neighbors means a lot, and we sure appreciate it. All right. So a few weeks ago, Catholic Charities launched a campaign that we called Be the Helper, inspired by this great Mr. Rogers quote that I'm sure a lot of you are familiar with. And we did it just as a way to sort of create a central hub where we could share what was going on at Catholic Charities, what were the needs, and to respond to this incredible community outreach to asking us, what can we do to help? How can we help? So we created this kind of central hub. And as Sherry mentioned, a lot of our work, just to give this audience a bit of context, Catholic Charities, a significant amount of our work is in providing emergency shelter and daytime emergency services, meals, and permanent housing to over 23,000 people in the Twin Cities in any given year. And a big part of that work is partnering with the public sector and the private sector and philanthropic sector to make this mission come together. And so something we just wanted to acknowledge right up front is this is a really hard time for the business community right now in Minnesota, and for individual families. And I hope that as we go through today's conversation, in addition to some of the insights you'll learn about what's happening in the service arena, one of the main headlines you'll take away is that Minnesota businesses are continuing to live their values even in the face of this incredible crisis. There are countless stories, and we'll share some today, of businesses that are facing their own questions about whether they'll be able to survive. And in the midst of doing that, are finding ways to use their resources to help organizations like Catholic Charities. So that says a lot about this business community. It's not surprising at all, but I really hope that that comes through loud and clear. So this is kind of the plan for today's discussion. As Sherry said, we're really comfortable with interruptions and questions, and so we really hope that you will do that. I think it'll be more interactive and fun for everyone, so don't be shy. And I think our goal today is to recognize that most of us are probably really familiar with the confines of our homes right now. And so we just want to share a little bit about what it means for people who don't have a home to shelter safely in, who are not having that same experience. And in turn, what are some of the challenges, the operational, really practical, tough challenges that presents for organizations like Catholic Charities who are providing direct service to people experiencing homelessness and families, children, community members who are really stretched and living at the edges. We'll share some examples of some incredible ways that organizations and people, individuals are stepping up. And of course, we would never leave today without some clear ideas about how you can help. So to kick us off, I'm gonna toss it over to Amanda.
Thanks, Jessie. I'm just gonna give some kind of grounding information about homelessness pre-COVID. We were already in kind of crisis mode. A lot of you are probably familiar with the Wilder data. They go out every 3 years and conduct interviews with people experiencing homelessness on a single night so that we can see the trends in homelessness over a period of time. And so the graph that you're seeing there is their latest data, which came out in 2018. And what we're seeing is that there was kind of a decline after the recession. We were reaching back to 2012 levels. But in 2018, we were reaching back up to more than 10,000 people, so reaching those pre-recession levels. And that meant that a lot of shelters, including Higher Ground and all of ours, were squeezing in extra bunks. We were adding mats on the floor. something that we never wanted to do, but just to increase our capacity and make sure that we were providing safe shelter to as many people as we could. But Wilder still found that about 30% of those that they surveyed had been turned away from shelter in the last year. So one of the most alarming trends that Wilder found was a huge increase in unsheltered homeless. And those are folks who are living in cars, in tents, in ice houses, places that are not meant for human habitation. So this is, the encampment that we saw in Minneapolis. We have a few in St. Paul. And those went up 62% since their last survey in 2015. But in the Twin Cities, it's even more dramatic with a 93% increase from 2015 to 2018. We were already at these really high levels, and then COVID just added a whole nother layer to it. And the people that we serve who are experiencing homelessness are already more susceptible to infectious diseases, whether it's COVID-19 or any of the other ones, for many reasons. A lot of them have underlying health conditions. Wilder found about 80% have underlying health conditions. That's often compounded with mental health issues. And so they're dealing with these underlying chronic health conditions that often are not adequately managed, whether because of mental health issues or access to primary care. It's hard to take medicine on a regular schedule. So those things are often compounded to decrease their health, which makes them more susceptible to infectious diseases like COVID. They also have less access to hygiene facilities to wash their hands on a regular basis. Those just kind of general well-being practices that help us all stay healthy. And so think about what the CDC is recommending to all of us, right? It's to stay home, to wash your hands, and to socially distance from others. Those things are just not possible when you don't have a home. So it's hard in a congregate setting, in a shelter, but it's even harder when you're unsheltered and living in a tent or in a car or traveling from place to place. I think we're ready for the next one. Yeah. And so all of these underlying health conditions make them more susceptible to infectious diseases like COVID. And then on top of that, many people experiencing homelessness are staying in a congregate setting like a shelter or receiving services in our daytime opportunity centers. And these are places where social distancing is just not possible. It's an oxymoron, and really by design. We finished Dorothy Day Place just last fall. We opened in early November, late October. And when we set out to design it, we created it so that it was one big campus where everybody could stay, where everybody could seek services and have dignified shelter all in the same place. Our caseworkers and people who are working on the front lines there every single day are working really closely with those experiencing homelessness, one-on-one support. And that kind of like really building up is really important to Catholic Charities and to other service providers. Experiencing homelessness can be a very socially isolating experience on its own. And so places like Dorothy Day Place were designed to kind of break that, but obviously makes social distancing really, really hard. We serve up to 1,000 people a day pre-COVID at Dorothy Day Place, where social distancing just isn't possible. Our shelter manager often calls Higher Ground St. Paul, where we have housing and emergency shelter, the bedroom, and the St. Paul Opportunity Center, the living room. So it really was designed to be one home, one campus, where people could receive support and connection and the resources that they need to find stability.
All right, thank you, Amanda. So we've intentionally designed service campus locations to be high volume, communal, connective, providing intimate support services, one-on-one, close proximity. So Catholic Charities, like so many other service providers, like so many other businesses, in the last several weeks has literally taken apart and put back together the way that we are delivering some of these services, doing our very best to try to support distancing and other measures to protect the people we're serving, our staff, our volunteers. I'm going to share just a few examples. I'll extrapolate on some of these that are on the screen. Some are a little more self-explanatory, but just a little bit of context to keep in mind. Catholic Charities has almost 600 employees. We're running 24/7 operations at nearly 20 different service sites and different kinds of programs, and we're serving over 1 million meals a year, big picture. So we're taking all of that and trying to unpack it and find ways to do it safely given the current situation. Some of the solutions that we've come up with are working well. It's like all of us, like all of the business community and the broader community, we're being forced to get creative and innovate, and that's not always a bad thing. That's a great thing in many ways. But there are also added costs that come along with this. So, as I talk about some of these solutions that have come together, I know this is the case for other nonprofits, other organizations. Catholic Charities is spending over $1 million a month in addition to its existing budget just to try to put into place some of these practices. So of course we're doing temperature screening and implementing various degrees of protective equipment, protective wear for clients and for staff in different kinds of positions. One of the things that has been the most complex and also really the most amazing thing to see happen is what we've created, an internal labor pool. So we have devised a system where those 580 employees are being redeployed from their existing positions to try to help in some of these frontline positions where we need the most support, where frankly it's the most complicated, challenging work right now. And so we've created this labor pool where we have grant writers and accountants and our finance team and HR and legal and people from the agency that are not typically in a direct service position, and they are being redeployed and supporting our frontline teams at our shelters and our housing sites, in our housing or warehouse distribution centers. Just any ways that we can find to try to shore up and support those critical areas that are feeling the pressure the most right now. The other way that we are managing the sort of human resource side of things is that those top tier frontline positions that are so essential right now are being paid time and a half. And that's a huge driver of that additional $1 million monthly expense that we're experiencing, but it's important for us to be able to maintain the kinds of staffing that we need. We have been forced to be creative about repurposing spaces. So Amanda shared, and you saw some of the visuals, our campuses were designed to bring people together in communal ways. And so as we unpack that, we've had to get really creative about repurposing entire wings of housing to provide quarantine and isolation space, reconfiguring spaces to allow people to spend time, be a little bit further away from each other, and yet still safely connect. Amanda also mentioned that a huge part of the model in providing the services of Catholic Charities is to help people build human connection. That's a basic need. That human connection is as important as a healthy meal or a roof over your head. And so the isolation that we're experiencing right now and trying to be healthy can be have a really traumatic impact on the people we're serving. So we're having to try to use spaces a little bit differently. Maybe one of the largest and most complex changes that's happening at Catholic Charities right now, and very likely at service organizations across the community, is changes in our meal service delivery. So I mentioned we serve over 1 million meals a year across all of our different sites, so very high volume. At Dorothy Day Place, for example, in sort of a pre-COVID normal operations, we are serving upwards of 400 people per meal 3 times a day, all in that cafeteria setting, in a really close quarters social setting. We're inviting residents who live in permanent housing on the Dorothy Day campus, often come to have their meals in the main cafeteria. And so we've had to really unravel and completely recreate that. We have developed a food operations system where, rather than having those nearly 400 individuals who are living in permanent housing on Dorothy Day Place, They are now receiving individually packaged grocery deliveries so that they can safely make meals in their own apartment homes and not come down to the main cafeteria for meals. That then allows us to try to increase some of the distancing in our cafeterias, although we're still serving several hundred people at a time, even with those reduced numbers in the cafeterias. So the logistics of that are incredibly complex, and the costs are complex too. Organization like Catholic Charities partners with incredible organizations like Second Harvest and others. Wonderful in-kind food contributions is how we normally do our food operations. Huge pallets of food come in large bulk quantities to our distribution center so that we can then really cost efficiently and logistically efficiently deliver those meals. And that has all been brought back down to an individual scale, which takes a lot more time and is a lot more costly, but it's the right thing to do, and it's the thing we need to do right now to maintain safety. So it was almost impossible to come up with just a handful of examples of incredible public and private sector partners stepping up to help with the response to this COVID crisis, that with Catholic Charities and with other organizations. That the great news is, like I said earlier, the headline here is that so much is happening. So much creative thought is going into how can we all chip in and come up with solutions to the problems that we're facing. One of them is happening as we speak. You may have read in the news over the last few weeks that the growing traction and success of using hotels to identify some of the most vulnerable individuals who are living in emergency shelters in the Twin Cities, Catholic Charities and other shelters, and find open hotel spaces for those individuals so that they can leave the shelter environment, be safer for them, those who are elderly and have really complicated health conditions. We literally, in Hennepin County, I think today is the first day of an effort where we're going to be moving 100 of Catholic Charities shelter guests out of shelter and into hotel rooms. There are another 100 in other organizations in Hennepin County. Ramsey County is going to be doing similar efforts. And so that allows people to be safe on their own, to safely shelter in place. It also allows people experiencing homelessness, like the rest of us, to contribute to our community effort to reduce the spread of the virus, so that they have a safe place to be during the day and are not forced to be wandering around the community without a place to rest and be safe. And it also significantly is a way that we are hoping to reduce the volume in our emergency shelters by almost 50%. So a shelter that might have, in Higher Ground St. Paul, upwards of 200 people a night, we're hoping to bring that down to closer to 100 people so that we have, again, every other bunk, more space between individuals, just doing everything we can to try to, in a shelter environment, increase the distancing and the safety factor. The other thing that's emerging right now, and you hopefully are seeing a lot of this on social media and in the news, are incredibly creative and generous business adaptations. I would say business adaptations because it's more than a philanthropic contribution from a business, which is so important, and we'll talk a little bit more about how that's happening. But these are literally businesses that are using what they do during this time to find a creative way to help organizations. So for example, maybe you've heard of the collaborative of distilleries that have put aside their spirits business for the time being and instead are using their people power and their technology and their resources to create hand sanitizer, which they are delivering in jugfuls to healthcare organizations and nonprofits all across the community. Catholic Charities has received our share of those donations, and that's an incredible partnership and innovation. Another great example of one that we've experienced is a vacuum company in Wilmer, Minnesota, has completely shifted its operations, embraced the change and their own business right now, and put their people and resources to work in creating thousands of masks, and delivered a package of 1,500 masks to Catholic Charities to use for our staff and clients. A dairy co-op in Wisconsin was faced with the reality of having to potentially dump milk because of the disruptions to consumer and supply chains. We've all read about some of those challenges. So they instead shifted their operations, made a ton of cheese out of that milk, and Catholic Charities found ourselves the recipient of 25,000 pounds. Am I right?
Yeah, I think that's right. And the really cool thing about the cheese donation is that we're using that to make sandwiches so that we're really preparing in case our kitchens can no longer deliver food, in case we can no longer do the grocery delivery, we will be prepared to deliver sandwiches for months.
Yep. And that's a great segue to this next item, which is, the other thing I wanted to mention is, and maybe some of the people on this call have experienced this, our media companies in the Twin Cities have been awesome during this time. They have another example of creative use of, they have a lot of ad space that was previously being paid for by business customers that isn't currently, and they've been really generous to organizations like Catholic Charities in allowing us to have that airtime for free to promote our needs, opportunities for people to support, so that's been awesome. Amanda mentioned the sandwiches, which then reminded me of volunteerism. So volunteers are essential workers right now. Volunteers supporting organizations that are essential are allowed and encouraged right now. And the great news is they are showing up. When this first started happening, Catholic Charities was really concerned about a dip in volunteerism. Rightly, people are concerned and wanted to be comfortable coming out to our sites and to understand how they could best be supportive and also be safe, and that's all absolutely understandable. We've created no contact, socially distanced, a range of opportunities for people to continue to volunteer. I think Hands On Twin Cities is on this call, so shout out to them. If you are, a great sort of one-stop place to go and find out if you're interested in volunteering, if your business or your employees or your team is able to volunteer. But that's a huge piece of this story that's been happening. And again, in true Minnesota style, not surprising. The last thing I want to offer, just as we've shared a few of these examples, is all of these examples that we've just talked about are came from a seed of an idea of a person working in their living room who has a friend who works at Catholic Charities, and a few emails later, we have 25,000 pounds of cheese. So like truly, my encouragement to everyone is to realize that this is happening at the grassroots level. Things are happening so quickly every day, every hour is shifting, as it is in everyone's world right now. So there are no bad ideas and really incredible things happening. So as we get to the home stretch here, I just wanted to sort of pull aside and spend a couple minutes talking specifically about the role of private philanthropy in this sort of COVID response reality that certainly Catholic Charities and many other nonprofits and direct service organizations are experiencing right now. From a Catholic Charities perspective, our emergency shelter and related emergency services pre-COVID in a regular situation are funded almost 90% by private philanthropy. So it's a major funder and driver of this work. And so the added pressure and the added costs to do business differently are really taking a toll. It's also the case for Catholic Charities and for some larger, mid-sized, larger nonprofits. We are not eligible for most of the CARES, federal CARES relief funding. There are some complexities. We're working on that with our delegation, but that's a difficulty as well. So all the more reason that the private philanthropy response that has emerged has been so welcome, so amazing, and so important. And there are really sort of four trends that we've noticed. One is the availability of just special COVID relief funds. You've probably seen some of this in the news, or maybe your organizations are involved in this. Incredibly valuable. Infusions of special dollars just fund those added expenses that are coming with the increased need and complexity of delivering services right now. The other thing that's happening that we're seeing is funders that are providing flexible use of existing dollars, another really valuable strategy for us, certainly. So an organization that may have funded Catholic Charities with a $50,000 grant 6 months ago for something specific not related to what we're doing today, is reaching out and saying, we still believe in the work that we funded specifically, but we know this is an extraordinary time. And so please use our funds however you need to manage your financial situation, to manage the kind of flexibility you need. And that's been really appreciated. We have seen new gifts and increased gifts from donors. Anecdotally, just month over month, Catholic Charities saw an almost 40% increase in giving in March of this year versus March of last year. Just that infusion of people who are able to, whose situation allows them to, being generous as they're able to. There will be campaigns in the next week or so, raising awareness about, some people may receive their stimulus check from the federal government and decide that, they might be in a good enough position financially to be able to use that to support organizations doing direct service. So there's a lot of that great stuff happening. Which brings me to the last item on the list. Hopefully some of you have been familiar with this or have heard of this, but starting tomorrow, what is tomorrow? Yes, May 1st is tomorrow. For a week, GiveMin.org is hosting a special Give at Home Min campaign, and they're sort of creating a one-stop, if you haven't checked it out yet, you absolutely should, a one-stop place where nonprofits can post specific information about their COVID response efforts, so that donors can go and, just like Give to the Max Day, make donations there. GiveMin is doing a couple of really awesome things. They are waiving their processing fee for gifts at this time, which is really wonderful. So 100% of those gifts come to the nonprofits. And just like they do on Give to the Max Day, there will be golden tickets and bonus gifts and all of that to try to maximize and stretch the generosity of folks on that day. So private philanthropy really stepping up, being creative and flexible, which is exactly what's needed right now. All right, Amanda.
Yeah, so at the beginning of this, Jesse introduced our idea of being the helper. And what we liked about that so much is that it speaks to all the ways that people can help. If you're in a position to give financially, we would be honored to receive that. If you're at home scrolling through Facebook and Twitter all day, spread the word. So there's lots of different ways that people can get involved, and I just want to share a couple of ideas. So the first is to spread the word. We're sharing a lot every day on our social media channels, on our website, in traditional media, because we really want to show community what is happening in our sites, what it's like for people experiencing homelessness, who don't have a home to shelter safely in place, what it's like for our frontline staff who are going to work every day, doing the hard work of providing these services to the most vulnerable in our community. And so we really want to show that to people, to see it and to feel it. So follow us on socials. Next week, we are kicking off our Dorothy Day breakfast. We're doing a week of gratitude. So throughout the week, we're going to be going live on Facebook from a number of different sites, so that people can see what it's like in Higher Ground St. Paul Shelter, what it's like at Northside Child Development Center in North Minneapolis, where parents are relying on us to continue to provide childcare so that they can keep working. So stay tuned and stay following us over the next week on our social channels, and please spread the word, share, like, comment. We'll take it all. The second is to ask yourself and your employer how you can help. As Jesse said, we have experienced so many creative ways to support our work. And if there's any lesson I am taking away from this, or one of the many lessons I am taking away from this, I should say, is that necessity is the mother of innovation. And this world that we're all navigating together has really allowed us to kind of break down barriers and just get to a solution really fast and in really innovative ways. So if you have a seed or a kernel of an idea of what you as an individual or as a family or as an employer can do, send an email or send a text to anybody that you know, and we will work to make it happen. We found really, really cool ideas. And like Jesse said, it's resulted in thousands of pounds of cheese, jugs of hand sanitizer, and we need it and appreciate it all. The third is to participate in the Give at Home campaign. Like Jesse said, They're waiving a lot of the fees, and it's a really great way to get involved and support not only us, but all the other organizations in the Twin Cities doing really good and really important work during this time. And finally, take care of yourself. This is going to be a marathon and not a sprint. So we're going to need you for a while, and we're going to keep plugging away and keep providing services to those most in need. So stay healthy and take care of yourself and your family. Thank you.
Thank you, Jesse and Amanda. That's really sobering information, but also really uplifting in the sense that the changes that you all have been making, working with partners to really address the needs of those experiencing homeless in our community at this time is really admirable. So thank you for all of your work. We are going to give all of our attendees now a chance to ask questions, provide additional information. You can do that in several ways. You can put your question in the Q&A feature. You can also put it in the chat feature. And you also have a hand raise function. And if you select that function, it will show us that you would like to talk, and we can unmute you so that you can speak directly to Amanda and Jesse if you have a question or comment for them. While we're giving you all a chance to get your questions logged into those features, I guess I can start out with one that came to my mind. You were mentioning that a lot of people, it's just a small kernel of an idea that maybe they know someone that works at Catholic Charities, for example, with the cheese donation, which I absolutely love on so many levels. And so I'm curious though, so if someone doesn't know someone at Catholic Charities, or if they do have kind of an idea, obviously it's a very busy time for you all. What is a good way to try and connect? Is there a certain department people should go through? What is a good way to connect?
Well, I will toss out two quick ideas that come to my mind, and I'm going to ask Amanda to fill in the details as well. One of the things that we have really been trying to embrace in this situation, like a lot of organizations, is that sort of all hands mentality. And sort of back each other up mentality. So people you might have normally reached out to, our volunteer department is a great example. On a regular day, the volunteer department has the capacity to be doing their field work jobs in the programs, and then also managing from their computer communications with potential volunteers and managing that system. As you can imagine right now, that's a good example of a team that is just out there doing the work. And so we have tried to shift and make sure that all of those general email addresses, info@CC-Twin-Cities is a great one that's always covered. We're sort of trying to make sure that those are manned. But another great example, I just want to go back to Amanda's, we've kind of shifted like the world to existing significantly via social media. And so that's a really awesome way too, through comments, DMs, whatever it is, just like we have people paying attention to those, and we can pull out those specific ideas, questions, links. That's a really awesome way to make sure you don't kind of fall into a black hole, which I know people kind of worry about when there's so much going on.
Yeah, I'm usually the one manning those. So you know somebody at Catholic Charities now, so send me a DM and we'll figure it out.
That's great. So we do have a question. Eddie is curious. We'd love to hear more about how Catholic Charities is helping to safely foster human connection with Dorothy Day Place and in the greater community. So great question.
Amanda, you wanna?
Sure, I can start. It's hard, to continue to foster community and to make sure that people are able to connect socially while isolating. And that's a challenge for all of us, I think, right now. But so we're implementing a couple of things. First of all, we're making sure that all of our residents in our housing units have access to like books and coloring books and games so that while they're isolating at home, they have things to keep their mind stimulated and things to think about and things to do. And then secondly, Jesse mentioned some of the repurposing that we're doing in the second floor of the Opportunity Center. So we've repurposed one big conference room into like a movie room. And so we're showing movies every day, and folks sit 6 feet apart. It's a big enough room, and we project Netflix and other movies up onto the screen so that people are able to still connect and see one another. And then the other piece that we're doing on that second floor is we have kind of a health space there that's just a big room where we continue to practice yoga and meditation and those things. And so that's continuing to happen and is really important. And then finally, just our staff is just doing incredible things of checking in with our residents and with our clients. You know, that grocery delivery is a really important piece of social connection, because it's folks knocking on their door and having a quick conversation while they're delivering their food. So those are 3 quick examples of how we're continuing to do that.
That is great. Good question. What's our next question?
I see a note from Hands On Twin Cities, which again, one of the things that I have been so impressed by, I know that our teams have been, is just the continued commitment of volunteers. And I'm hoping that Hands On and other nonprofits have seen that same dynamic. There's a lot of fear in what we're experiencing right now as a community. And so I think one of the things we were really worried about is that people would be afraid to continue to engage and to come out and support community organizations. And we've been so heartened that that hasn't been the case, that people really have been committed. And so thanks to, if you have done that, thank you. If your organization is supporting your employees to do that, thank you.
Yeah, and one of the really cool things is that we've had an increase in new volunteers. So folks who are just coming out by themselves or with their families or the people that they're quarantining with. We've seen a huge increase of people who are volunteering for the first time, which is really great.
So we have a question. What's the governmental role here versus charities, and where are the gaps?
I want to offer an initial sort of just some information about kind of where our partnerships are right now, and then I'm going to ask Amanda to provide, fill in some of the details as well, because this is a really great question. And I mean, I'll go back to Amanda's comment that our experience right now, I mean, Catholic Charities is, and as are many of our colleagues in this business, kind of see ourselves as like living, breathing public-private partnerships. So just on a regular day, our work is happening in lockstep and in such coordination and partnership with counties and cities and state and federal agencies and all the partners that are doing the work and various funding streams. The biggest, I would say, a huge amount of collaboration and coordination has been happening in the last several weeks, more than normal even, which is a lot to begin with. At the county level, counties are playing a significant role right now in coordinating plans for shelters and unsheltered, and expanding and finding spaces, facilitating the partnerships with the hotels to move people. So that is where a significant amount of the partnership is happening. I mean, part of the question I think might be to sort of what are the various roles? And certainly from our perspective, one of the things that that we see that government can do really well and importantly is a convening and organizing function, because there are so many direct service providers on the ground and there's so much need to be integrated that when the sort of central government agency helps to create a forum and the kind of collaboration supports those systems, it helps us all be efficient, elevate the issues that are happening and quickly get to a solution. That's happening at the state level as well. Sort of kudos to the Walz administration and key leaders who are creating in this COVID response an effort statewide to try to create an umbrella that will bring together all of the shelter providers and related service providers so that we can be coordinated, efficient, quick in what we're doing, in addition to the funding question, which is significant as well. Amanda, are there details you want to fill in?
Yeah, I would just add, you know, we say it a lot that we're lucky to be doing this work in this community for a number of reasons. Because of the public and private partnerships that Jesse mentioned, we have so much support from our private partners, and public partners are willing to think creatively and understand the importance of housing and the risks of homelessness. So we're really lucky in that sense. But what I would add is that so I shared a little bit of the state of homelessness before COVID and the kind of crisis that we were experiencing. We rely on private funders for 90% of our operations at Dorothy Day Place, which is just unsustainable. So we have been advocating really strongly for an increase to what's called the Emergency Services Program. And that is really the operations dollars from the state, and it receives some federal funding as well. But really, we need a state increase that will allow us to respond and provide more services to people experiencing homelessness. And that was before COVID. And so that's just only going to increase as this pandemic takes hold and we really realize the full effects of it. So, you know, I think there are places to increase public support and continue to work with our public partners. Mm-hmm. And then the last thing that I'll add just really quickly is that our state partners have been really thoughtful about the unsheltered population throughout this pandemic. So Governor Walz created an executive order to not move people who are sheltering outside. Now he just kind of clarified that yesterday, that there are some cases in which they can move, which is good. In case, you know, a big encampment starts to grow and then we're worried about social distancing and those kinds of things. But in this pandemic right now, we really want people who are staying in tents to stay where they are and not to be traveling throughout the community just because it lowers the risk of spreading the virus. And it's disruptive to the people that are living there. So we've been really lucky in the fact that the governor and the Walz administration has been really receptive to our and other service providers' expertise on that kind of an issue.
That's a great question. We have another question that kind of takes us into a little bit of a different realm, a really important question. One of our participants works with a lot of students who are experiencing homelessness. And what can they do to help connect the youth with your services?
Amanda, I saw you unmute. Do you have a?
Our big shelters are mostly adult shelters, but we do have Hope Street for homeless youth in South Minneapolis on our St. Joseph's campus. And I think, I don't know how we get connected to that.
One resource I will put out there just in general, and I'm sure as a service provider, they may be familiar with this as well, but United Way's 311? 211, thank you. They have shared, and some folks have seen a dramatic increase in utilization of the 211 helpline, but that's a really great resource for whatever population you may be serving or connecting with in your work or finding out about a need. That's a really good one-stop starting place to identify what resources might be available and help someone start navigating, because that's really, really difficult. It involves the kind of frustration, the timing of that kind of frustration, making call after call after call, looking for something you desperately need. That's a resource that can help streamline that process.
As kind of a way to kind of wrap it up and bring us home, curious final thoughts, if you can expand maybe on what the the corporations who are on our call who have foundations, what their volunteers are doing, where their businesses and their employees can kind of step up or expand their efforts.
Yes. So, I mean, I just did a sort of a quick look at the attendees. I think nearly every business that's represented on this call has in some way been connected to Catholic Charities and has been present in what's going on right now. One of the things that has been really heartening that I would say is a place to start is we have received so many proactive phone calls from our corporate partners, whether it's our volunteerism partners, our philanthropies, or corporate responsibility teams that we partner with. They have been reaching out to Catholic Charities asking, what can we do to help? What's your need? They're figuring out, you are, just as everyone else is, trying to figure out what's going on with your own operation. So you don't actually know necessarily what you have to help, but asking the question has generated some of the best ideas and ways for help. We mentioned that we have safe, socially distanced, no contact volunteer opportunities. There are some businesses now, as this becomes a bit more of our normal, the volunteerism has been a huge part of building corporate cultures, especially here in Minnesota, organizations that encourage their employees to take work time to get out and volunteer. And so that's one of those things we're trying to figure out, how does that work in this new way that how do you do team building when you're living virtually? And so there are ways we would welcome conversations about how we can try to support some of those culture and team building efforts through volunteerism and partnerships with Catholic Charities and other kinds of organizations. And again, I think the big message here is you don't have to have the idea, just the sentiment, we think we can help, could we do this? And then we'll figure it out because we're all working off of this right now. And then finally, just some of those things we talked about, creative philanthropy. Creative use of resources. Can you introduce flexibility? Are there additional resources that are available right now? If there aren't, can you offer nonprofits creative ways of using the resources that you might have? All of this is happening. It's what gives us these ideas to share, which is just, again, the headline here. Businesses are struggling right now. We know that. They are thinking about their future. They are trying to figure out how to remain strong and continue to move forward. And so it's really something that it didn't happen. It hasn't happened that businesses just set aside their commitment to community. It has stayed as essential as their core operations, and that is a huge takeaway.